of the family.
Yeah. So mainly it was just sort of differences in the process of work, would you say? Like things of, being the anesthesia being administered beforehand in a separate room, wheeled in, probably, I guess it's just a different process to get used to. Nothing too
Nothing too
intimidating.
drastic, I'll say.
No.
People are very accommodating, and the patients are looked after very nicely. So
And you would say now, like you said, you feel a part of the family. How long would you say it took for you to, to feel a bit more settled and a bit more comfortable after
I think
starting?
it takes you 3-4 months, like to get around to knowing everyone,
Yeah.
how things work, the smaller details, how you order blood tests or X-rays or things like that, how the computers, like how the electronic system works. So getting used to it. So it takes 3 months, I guess,
Yeah.
almost.
And how did you feel about the support that the actual department and the hospital gave you when you started?
Oh, my department was very welcoming. It's I cannot complain about a single thing. So they have been very, very helpful, and it still holds true. So everyone looks out for everyone. So it's what I say. It's one of the probably the best department I worked with till now, and even the management was very quick to answer any queries I had. So yeah, I'm very, very happy.
Oh, great. What would you say as well? What would you say would be the main differences between working, back home in India and then now working in the UK?
Uh, the main difference is I would say that it's like there is no hierarchy. Okay, so that is a very, very good thing that I appreciate, that which we may not have that back in India. So everyone can put in their own opinion, even if it's a consultant you're working with. If you feel that something is different, you can put your questions or you can put your views like unabashedly, and no, even the OTPs, what I was saying. So even the OTPs, when they feel that I am doing something wrong, they can easily tell me something, and even with the consultant. So that is a very good thing. One more thing that NHS, what I'll say, tries its best to take care of everyone, like whatever its social status, what's your religion or race, like everyone is given the best service possible, so that what I'll say, the patients feel safe and comfortable.
Mm.
Emergency services, I felt here is much, much better. The way the paramedics and the ambulance works here, ambulance services works here, and if they need a, what I'll say, complex procedure or something, the agility and the rapidity with things work here is pretty recommended. Like, I'll definitely appreciate that. My dad was needed something like that when he was on vacation. So I've been on both sides of it.
Yeah, it's something you can relate
So,
to.
yeah,
Yeah.
yeah,
Yeah, so I mean, overall, it sounds like it's very positive feedback overall from being here and working
yeah.
within the NHS.
I think maybe the elective people waiting for on elective lists have to wait a bit.
Mm,
But I think it's due to because NHS isn't too under too much pressure.
mm.
That's something that I think we cannot do anything at our level right now.
Yeah, yeah. So it sounds like from your description, it's more of a there's more of a team, a team feeling within the department, where you described like you could share your opinions and
Yeah,
whether
exactly.
it was a consultant or whether it was
Your
a level.
junior or your senior, you
Yeah.
can convey your ideas at any
Mm,
point.
yeah. No, that's hopefully that gives all the doctors out there listening a really good insight to to the
Is it
NHS.
live? Is this live?
Not live, no, but it will be recorded. Yeah. No, don't worry. Um, so sort of back when you started career, what was it that made you choose anaesthetics in the first place?
So back in India, once you finish your undergraduation, and when you have to choose your post graduation, it's more of a rank based system. So you give an exam, and depending on your rank, you have to choose subjects. So I was like never a very good student, but yeah. So I was getting options like surgery, gynae, and anesthesia and psychiatry. So never wanted to be a surgeon.
Mm.
So yeah, between anesthesia and psychiatry, I chose anesthesia. And so initially did not have much of an idea, but the subject slowly grew into me.
Mm.
So the logical approach into every small detail is something I really like now. And so I have developed skills like predicting uh, critical conditions before they happen and ways to avert them. So you really have got seconds to change something
Mm.
before it happens. So that
Yeah.
that insight and that skill I really like that. I've developed
Yeah.
that now, I think.
Mm.
So that is a thing that I like very much.
So you've
So
almost grew to love the speciality.
a subject, yeah,
Yeah.
exactly. It was
Yeah.
not some. It was like arranged marriage.
Yeah. 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 But now you've grew,
So
and it sounds like
yeah,
it's it's something you've really.
I'm happy with the marriage. Yeah.
Yeah. Yeah. um. So, going on from anaesthetics, what was your sort of expectations with the anaesthetics, in the UK, in the NHS as such, compared to your what were your expectations
Yeah.
compared to what the reality is of the anaesthetics departments?
So I expected like more emphasis on patient safety and every detail of it, and how anesthesia is carried out, the more protocolized treatment, and the use of like what I'll say, uh, modern anesthetic workstations,
Mm.
more technology like ultrasound and everything into in doing the simple things. So yeah, so I'm not bit disappointed. It's we do it pretty nicely in every day, and I have access to all of them. So even in the emergency hours, which I did not have so much back in India. So yeah, I'm given independent chances to put in nerve blocks and do ultrasound guided procedures, which I'm enjoying a bit, pretty much
Yeah,
enjoying.
that's good. Yeah, it's really good to hear that actually. Um, One thing.
Uh,
Oh, sorry. Carry on.
yeah, and a healthy atmosphere. I forgot to tell that. So
Oh,
yeah,
okay.
friendly, healthy atmosphere. I'm
Yeah.
really enjoying that now.
So it sort of lived up to your expectations, or
Yeah,
or
it did.
exceeded them even.
Yeah, initially after the settling down phase, which is always difficult when you're moving into
Yeah,
a different hospital. But yeah, I'm
that's
I'm
great.
good now.
Yeah, great. Um, when when going through your anaesthetics training, what because there's a few obviously the GMC process is something that all of our doctors have to go through. With that, they obviously need their post graduate qualification. One of the most common ones, EDAIC. Did you go through the EDAIC route? Is that
No,
the post?
so I had given the EDAC exam, but I did not go through the tier two EDAC route
Okay,
because I was referred to Bedford Hospital by one of my seniors,
right.
and so I had my part two EDAC exam in London. So that's the time I came over to Bedford, and there
Mhm.
was not a tier two vacancy then, but I liked the vibe of Bedford, so I wanted to stick with it.
Mm.
So I continued with the tier five.
Okay.
So yeah,
Um,
but Iraq has been what I'll say life changing.
yes.
So that was the first time I ventured out of my country, and I found the examiners to be pretty friendly.
Mm.
So I was pretty stressed out, but they helped me to de-stress during the exam.
Yeah.
A lot of attention was given to the details, the basic what I say basics of physiology and pharmacology, and even physics and statistics. So anyone who is preparing, I think you have to revise a lot about
Yeah.
because back in India we may not be dealing with so much details about statistics and physics of the physics, which we may not be what I say applying every time we do an anesthetic, but for the exam, sorry, I think it's pretty important.
Yeah. I mean, so you sort of touched on it a little bit there. Do you have any, any other tips for anaesthetists coming over and that would be sitting the EDAIC exams?
I think the MCQ exams now are held in India, so I know that the competition is getting very fierce. So
Mm.
mark your dates, uh, get your seats booked as soon as it opens because many of my juniors have told that they tried to book in after a few days and there were no seats left.
Mm,
So book it as soon as possible. For the MCQs, I think there is a lot of online courses, and there are pretty. I personally I used the Get Through FRCA MCQ books. Those
mm,
are pretty helpful. You can read textbooks like Fundamental of Anesthesia by Pinnock. You can the Plunkett as a revision book is very helpful for the Viva because a lot of graphs and basic things are asked from there, so you can directly quote it from there. And pharma, you can read from Pick and Hill a bit, but I did a shortcut and I read it from podcast.
mm. Okay.
So yeah, so you can do that as well. So the examiners are very helpful. You do not need to be too much stressed out. Yeah, I think the pattern is changing a bit. They are including CT scans and things like that because more and more people are giving EDAC for a GMC registration, I think.
Mm, definitely.
So,
Yeah.
but it is achievable if you give good 2 months to your preparation.
Mm,
I think it's definitely achievable.
yeah. Okay, great. No, that's. I'm sure that's going to be very helpful for all the doctors out there. Um, so essentially, make sure they get it booked in early because they're
Yeah,
because it's getting busy now, and
yeah, exactly.
there was I'm sure they can replay, and there was you give quite a few books or even podcasts like you did that they can listen to or read and get their information from there. Um, sorry about that. So any other tips? Not so much on the EDAIC exams, but just new doctors moving over to a new job post in the NHS in anaesthetics. Any general sort of tips that you'd give them? Anything that you would have liked to have known back then when moving over here that maybe you can sort of give the doctors a little bit of a tip now.
I would say I've told about driving and all those things. So I'll just say
Yeah.
come with an open mind.
Hmm.
It might feel a bit lonely initially, and it takes a toll on you. The things like you have to do all your cooking, washing, grocery shopping. So you probably work like 8 to 10 hours per day, and then so you have to plan your things on your weekends. If you're going on long shifts, you have to maybe cook your food and keep them in the fridge.
Hmm.
And so things like that, it takes a bit of toll on you initially. But I think on a sunny day, like the view of the Lake District or the London is there is nothing better than that.
Hmm.
So I think you will overlook the smaller aspects and
Yeah.
yeah, you missing family and all those will be there. But yeah, I think once you're settled, if you get a apartment to yourself, you can easily call them over. They can stay with you for 6 months.
Hmm.
Uh, when I wasn't working in Delhi, I never went home for more than 15 days.
Yeah.
My mom and dad came and stayed with me for 3 months. So
Ah, that's
yeah,
nice.
so
Yeah.
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 So I think
Um,
I think you'll get adjusted to it.
Yeah, so you'd say maybe try and get adjusted into a routine, when you're here,
Yes, yes.
just so you don't feel a bit, overwhelmed with all the new responsibilities that you
You
may be
won't
having.
you won't get much of a time if you're doing emergency shifts. You won't get
Mm,
much time either. So it will be a pretty busy life. But yeah, so get a hobby if you want. If you travel or you play your instrument or you good in photography or you want outdoor skills, whatever. If you can engage yourself with that, there is a lot of scope there. There is a life outside medicine in
yeah.
UK.
Okay. No. Great. I'm sure they can all really appreciate that. This is all information that they're going to take in, and hopefully after watching this video, they will have a lot more of an understanding. They feel a little bit more not as intimidated by the whole move,
Yeah,
and
yeah.
so it's
Nothing to be intimidated. Yeah, moving into a different city can be a fearful factor sometimes, but
doesn't need to be.
yeah, doesn't need to be
Yeah.
exactly.
Okay. Um, one thing we could have touched on was the ICU side of things as well. So I understand your role itself. You have a split between sort of the general anaesthetics and the ICU department as well.
Yeah, right, right.
Um,
So in my 2 years of MTI, I should be doing at least 3 to 6 months of intensive care.
mhm,
So I have already started it, and yeah, it's a very different experience. What I had back in India. So here, intensive care is much more focused. You have a lot of support staff. You have nutritionists, the nurses are very, very well knowledgeable and what I'll say experts. So they do most of the stuff. So you work with microbiologists and pharmacists to mainly look on the clinical aspects of the patients, and you have good, what I'll say, technology to support every patient. And if you need patient referrals and everything, that happens pretty quickly,
Hmm.
like in the to the tertiary centers. So that is also good. And yeah, so we do long days, we do night shifts also in intensive care, and those can be hectic, but yeah, it's not bad. So back
Yeah.
in India, I did not like intensive care at all.
Okay.
It's not too bad at all here, not too bad.
How does the so you say you didn't enjoy it much back home. What would be the main differences between the ICU here and the ICU, but back in India where you worked?
So most of the intensive cares that I worked in the hospitals that I worked was many things. Most of every decision had to go through a doctor. Okay, so that's what I'm saying. Here it is what I'll say. They have channeled it out. They have many other personnels, like you have for deciding what exact diet every individual should have. You have dietitians. You have microbiologists who decide on the antimicrobial therapy with you. You have pharmacists who can decide upon the interaction of drugs. Like intensive care patients are on a lot of medicines all the time. Okay,
Mhm.
so if there are any drug interactions between the medicines, or what should be the doses according to the kidney function or liver function, so you have pharmacists to decide for it. So yeah, so you can concentrate on the ventilator settings, on the clinical, what I'll say, how and when the patient can be weaned off from the ventilator,
Mhm.
and the progression of the disease. So I think you can much focused approach we have here.
Okay, yeah, that's great. Um, so personally, so either back home or here, just a personal question. What side do you enjoy more? Sort of the general anaesthetic side,
Always,
or
always,
always yes?
always,
How
always.
come? How come? What's the
Uh,
how come you prefer that side over ICU?
so in anesthetics, you can always have a coffee break when you want.
Okay, okay.
So no, so basically, for becoming an intensivist proper, you need a good depth of medicine also. Okay, so that needs a bit of more studying.
Yeah,
So yeah, but I feel that I'm much better off doing anesthesia. So it's a personal choice, more thing. I
yeah,
think, I
yeah.
guess.
Of course. So before we finish off here, just to give them an insight on what your sort of day-to-day life would be now that you're working in the NHS. What does a typical day look like for you in the hospital?
So I work like 48 hours per week. So it can be on either the weekday shifts like Monday to Friday, or if you are like we start at 8 o'clock and finish at 6 o'clock. For that's almost like 10 hours for five days. And if you are doing night shifts, it starts again at 8 in the night and go up to 8 in the morning. So it can be busy. It can be busy, especially the maternity and intensive cares can be
Mm,
pretty busy. So yeah, but you get, I think, good number of leaves before and after your shifts.
okay.
So you get time to recuperate. And yeah, and working in the emergency shifts, you get to work for trauma calls with the A&E doctors. For you get to transfer patients in through those blue light ambulances. I love that.
Mm,
Okay, so so yeah, so that you can enjoy a bit. I think you will enjoy your work. It
yeah.
is a lot of paperwork. It is a lot of paperwork. There's a lot of
Mm,
formality, lot
okay.
of paperwork involved in every step you do. So that
Okay.
initially can be intimidating, but you get used to it.
Mm,
And I think it is also very necessary because of all the medical legal purposes.
yeah.
Good documentation is always very necessary. So yeah, not bad.
Does that differ from back home, or is that something that you
Yeah,
you
I
were
think
you
I
were
think I think it differs from back home. We
okay?
do document back in India also, but the level of documentation that you do here,
Mm,
I think it's much more times, like,
okay.
or I'll say 3-4 times more documentation we do here.
Ah,
So
okay. So that's what one thing to bear in mind. What would you say is a little bit more in depth, or?
Yeah, I think it's much more in depth so that nothing is missed out. So
Okay.
like then maybe the doctors, the nurses, and the administrative professionals are documenting the same thing.
Mhm.
But yeah, so that nothing, even the smallest thing doesn't miss out.
Yeah.
So
Okay.
because when you're in a court, if it is not written, it's not done.
Yeah.
So
Okay. So that's that's something
and
for them to bear in mind. Maybe a slight difference from where they worked before. Um, but the department. What is your department like in Bedford? Can you give us a little bit of an insight into the department?
what I'll say, my department has a lot of Indians, British British origins, and Europeans. So we have a good multicultural,
Mm,
what I'll say, set here, and everyone is very helpful. Everyone looks uh, for after each other whenever you need any help, or you're like, even I can say from a personal experience that we did spinals back in India a little bit differently. Like we used different needles, spinal needles back in India. So initially, like even after I had 4 or 5 years of anesthetics, coming here using a different spinal needles, I was not able to uh, put in spinals. I back in India I used to do spinals with eyes closed.
mm.
So yeah, so coming back here, doing in a different, using a different needle, it took me a few times to get used to it. I failed a few times, so I was just
Okay.
sitting one day a bit sad because what is happening to me? Like
No.
I cannot even do spinals now. But yeah, a consultant came to me and talked to me and said it's very normal, and
Mm,
within a month you'll be back to your best. And yeah,
yeah.
literally that happened. So but yeah, so that she approached me without me even approaching her.
Mm.
So I
Yeah.
appreciate this thing.
So they're very supportive,
Very, very
supportive and
supportive.
helpful. Yes.
Yeah, yeah.
Um, so that was just due to sort of the change of equipment, the equipment being different, and
Right.
then just getting adjusted to the new
Yeah,
equipment.
exactly.
Okay. Yeah. No, that's fair enough. Um, so that was essentially on to my next question about the support. So I mean, as you've just described, it sounds like the support that they give is, that they're there to support you, and it sounds like they're very helpful as well with helping you
Yeah,
adjust to
yeah.
things.
I have no complaints. Literally, I have no complaints.
Yeah, great. So for yourself, what are your plans for the future now? Then, do you have any plans to, what is there? Go for FRCA or maybe sit through, go
Yeah,
through
I'm
CESA?
sitting. I've already started doing my FARSI exam, so I've cleared my MCQ. I'm supposed to clear my OSCE Vivas in January, but I've not started yet. Don't know what will happen. So and Christmas is around also, so
Yeah,
let's
yeah,
see. But yeah, I'm onto it. So the FRC is definitely a target, and yeah, maybe probably I might join training. So because I haven't dwelled into the Caesar route yet,
hmm
so I need to get a little bit more information, then take a informed decision maybe what to. But yeah, training is a very good lucrative option, and most of my consultants are telling me to, at my age, that should get into training. So yeah, maybe I'll do that. Other plans, yeah, so that is my probably become a consultant. Either ways, either Caesar or a training pathway. Uh, what I'll say, buy a Jag.
Okay, okay. So, you're a
And
fan of the
sometime,
Jaguars, yeah?
yeah. So yeah, that's definitely a future goal.
Yeah.
And travel lots, get used to the multicultural thing, have experience the multi cuisine, and definitely do something other than medicine. Like I love swimming, so maybe I'll try scuba diving. Let's
Yeah.
see.
Yeah. Okay.
So
So yeah, no, it sounds like you've got it sort of all planned out then. You know, yeah, no, yeah,
hopefully,
yeah. Hopefully, hopefully.
fingers crossed.
It sounds. I mean, it sounds great, and I wish you luck in the future as well.
Thank you so much.
But is there anything else? We'll start to wrap it up now. I'm sorry, I've taken so much of your time.
No, no,
Um,
that's all right.
I'm sure all the doctors will appreciate it. Is there anything that you'd like to add now for anyone listening?
The only thing that I will say that if you're planning to come to UK or any other country, for instance, uh, act quickly, okay? Because at least in UK, the competition is increasing. So the number of IMGs are coming over is increasing by multiple, I think multiple times. It was by 2-3 times. It's increasing per year. So and even in anesthetics, I think probably getting a MTI job was much easier than it's today. So there is a bit of wait before you get an interview. So don't be disappointed. Keep at it. And so you can also give EDAIC, or even you can write, I think, the primary MCQ directly back from India. For OSCEs, you have to have an experience over here. So yeah, keep at it, and you should be able to do it.
Great.
Perseverance, that's the key.
Yeah, that's
And
it.
believe in yourself.
Yeah, great. No, thank you.
Yeah.
Okay. Thank you very much for your time, Doctor.
Thank you so
Appreciate
much.
it. I'm sure all the doctors that will appreciate it, and I'm absolutely sure that everything you've said will be extremely helpful for